Today I'm talking about management of eczema or very dry skin. So the management is mainly by moisturizers, sometimes also known as emollients. There are two types, one are creams and second is ointments. Creams are water based and ointments are oil based. Ointments are better because they stay on the skin longer. So thicker the moisturizer, the better. If you hear that the skin needs to breathe, forget about it. The skin does not need to breathe. You have to cover the skin and provide a barrier for the moisture to be locked in, and the skin by itself produces oil. So avoid soap and bubble bath because that removes the oily layer of the skin. So you don't need soap or bubble bath. Sometimes you might need a soap alternative like dermol, but that's got some antibacterial in it. So if the skin is not infected, you shouldn't be using it for a long term. Skin always has bacteria on it, so we can't get rid of bacteria from the skin. So avoid soap and bubble bath. If there's a trigger, if there's an allergen which is causing the dry skin, like house dust mite, it's actually the house dust mite poo. They poo a lot, and that can trigger bad eczema. So the mitigation strategies for that are wash all the linen at 60 degrees. All the soft toys can go in the freezer overnight, and that kills the house dust mite. If there's a carpet in the house, that needs to be steam cleaned professionally once every 6 months. And then you can buy some mattress protectors which are anti-allergic, which will prevent the poo of the house dust mite coming in contact with your skin. One example is Eller Guard. You can Google that and buy that for your mattress, for your pillow, and your duvet if you're allergic to house dust mite. But the main treatment for eczema is moisturizers. So you have to basically apply a lot of moisturizer. So this is something else, but I'm just to show you, you have to take a lot of moisturizer and apply it in one direction only. So going down, don't need to do this because that will damage the oily layer of the skin. So go down and leave it. You don't need to make it disappear because it will absorb by itself. Sometimes if there's a flare up, which is a severe inflammation of the eczema, you might need steroids. Again, when they say use sparingly, it doesn't work. So you have to use what we call a fingertip unit, which is like this. That's a fingertip unit, and that has to be used for the area of a palm. So this will be covered by this much of steroid. There are lots of types of steroids available, but don't worry about using them for short term. You will need them to clear the flare up. After that, you have to use the emollient. Leave a gap of half an hour between the steroid and the emollient. You might also need an oil in the bath. So leave the child in the bath for about 10-15 minutes. Take them out, pat them dry with a towel. Don't rub their skin, pat them dry. Take the steroids for the flared up areas, leave half an hour gap, and then apply a lot of moisturizer after that all over the body. And you can use the moisturizer many times a day so that there's a good barrier, and that will hopefully prevent flare ups. And you might need to use steroids for a short duration to clear the flare up and then follow it up with lots of moisturizers.